Native TV presents Maternity Voices.
We have the mandate as a government to supervise or to coordinate delivery of health services in the country. The supervision, licensing and supervision of health facilities is done under the councils. There are three councils. There's the Council for Doctors, which is called the Uganda Medical and Dental Practitioners Council. There's a Council for the Paramedics, which is called the Allied Health Professionals Council. And there's a Council for Nurses and Midwives. So the different councils are responsible for licensing and partly supervision to ensure standards. But supervision is also a role that's played by Ministry of Health and KCCA, specifically for Kampala. There could have been gaps because these three bodies need to work very closely. KCCA needs to work very closely with Ministry of Health and the other councils to ensure that the health facilities that are providing care to the mothers are providing quality care and it's standard across the board. If we say a theater should look like this, that's how a theater should look like. If we say an outpatient department for a medical center should look like, that's how it should look across the board. So what has happened is that there are different levels of care. You see the standards are not the same across the board. And this really has caused a lot of damage to our patients because as you saw, 90% are private. There are so many in the communities and very close to the people. So they end up being the first lines of care for our mothers and the sick newborn. And if there is no quality of care, then the mother is potentially going to have a bad outcome. So one of the things that we are emphasizing is to make sure there are those joint supervisions with the councils, KCCA and Ministry of Health. There's already a full-time department here that's designated to do accreditation and standards, and I hope they are working very closely with the professional councils to ensure that that one happens. So I think that's a very good area that needs to be strengthened to ensure that our mothers and babies get the best possible outcomes.
Maternity Voices is brought to you by Native Voices International in collaboration with White Ribbon Alliance, WRA Uganda, thanks to support from USAID through East-West Management. No woman should lose a life while bringing a life to this world. In Uganda, the high maternal mortality of 326 by 100,000 deaths is preventable if all necessary precaution is taken by, among other interventions, ensuring that all mothers make all the required 8 antenatal visits, have health facility-based delivery, are delivered by qualified and skilled health providers. Mothers are treated with dignity and respect, have access to health facilities. Health facilities are well equipped, hygienic with the necessary medical supplies. Health providers are respected and mother's consent is given before a procedure. For this to happen, we all have a role to play by exercising respectful maternity care, demanding for it, and creating awareness about it. Join us as a partner in the campaign to establish a respectful maternity care. You can start by liking this video, sharing it in your networks, and subscribing to the Native TV YouTube channel for updates on this campaign and other common good initiatives.